Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Eating Assessment tool assesses the severity of dysphagia symptoms in patients. It measures functional swallowing abilities and the impact of swallowing difficulties on quality of life. The tool consists of a self-administered questionnaire with 10 items related to swallowing function. Its main purpose is to screen for oropharyngeal dysphagia and monitor changes over time. The Eating Assessment tool aids clinicians in identifying patients at risk for aspiration and subsequent complications, such as pneumonia. It supports clinical decision-making for further diagnostic evaluation and treatment planning. The Eating Assessment tool is indicated for adult patients presenting with symptoms of dysphagia or at risk for swallowing disorders. It is frequently used in populations with neurological conditions, such as stroke, Parkinson's disease, and multiple sclerosis, where swallowing difficulties are common. The tool is also valuable in head and neck cancer patients undergoing treatment that may impair oral intake. Clinically, the Eating Assessment tool serves as a quick and reliable screening instrument in outpatient and inpatient settings to identify individuals who require further comprehensive swallowing evaluation. Its use facilitates early detection of swallowing impairment, thereby guiding timely intervention and management. The Eating Assessment tool consists of 10 items designed to evaluate dysphagia symptoms. Each item addresses specific aspects such as swallowing difficulty, pain, and impact on eating. Respondents rate each statement on a 5-point Likert scale, ranging from 0, meaning no problem, to 4, indicating severe problem. Scores from all items are summed to yield a total score between 0 and 40. The assessment is administered by presenting each question verbally or in written form, ensuring the respondent understands the content. Interpretation of the total score involves a threshold value of greater than or equal to 3, which suggests a risk of swallowing dysfunction, warranting further clinical evaluation. Scores below 3 generally indicate the absence of significant swallowing issues. Higher scores correlate with increased severity of dysphagia symptoms. The tool demonstrates high internal consistency with a Cronbach's alpha of approximately 0.95 and good predictive validity for identifying patients requiring referral. The Eating Assessment tool, 2020, or EAT-10, demonstrates a sensitivity ranging from 85% to 95% in detecting dysphagia, indicating its ability to correctly identify patients with swallowing disorders. Sensitivity refers to the proportion of true positive cases accurately recognized by the test. Specificity values for the EAT-10 generally range between 70 to 85%, reflecting its effectiveness in correctly identifying individuals without dysphagia, also known as true negatives. In clinical practice, a high sensitivity ensures that most patients with swallowing difficulties are identified for further evaluation, minimizing missed diagnoses. Conversely, moderate specificity means some patients without dysphagia may be falsely classified as at risk, potentially leading to additional but necessary assessments. For example, if a patient scores above the established threshold on the EAT-10, the test sensitivity suggests a high likelihood of true swallowing impairment, while specificity indicates the probability that a low score accurately excludes dysphagia. The Eating Assessment tool was developed in 2005 by Belavsky and colleagues to provide a quick, self-administered screening instrument for dysphagia symptoms. Its initial validation involved a cohort of 125 patients presenting with swallowing difficulties and a control group of 50 healthy individuals. Results demonstrated high internal consistency with a Cronbach alpha of 0.94 and excellent test-retest reliability with an intra-class correlation coefficient of 0.98. Concurrent validity was established through significant correlations with established clinical measures, including the penetration aspiration scale and video fluoroscopic swallowing studies, with correlation coefficients ranging from 0.6 to 0.85. Since its inception, multiple studies across diverse populations, including patients with stroke, head and neck cancer, and neurodegenerative diseases, have corroborated its reliability and validity. Furthermore, systematic reviews indicate that the eating assessment tool maintains strong sensitivity and specificity rates exceeding 85% in detecting dysphagia risk. Additionally, translations and cultural adaptations have undergone rigorous psychometric evaluations, confirming the tool's consistency across different languages and clinical contexts. This body of evidence supports the eating assessment tool as a robust patient-reported outcome measure with clinically relevant applications in dysphagia, screening, and monitoring. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.